In Jefferson County, our positivity rate of cases has gone up well beyond 18%, and we know that anything higher than 5% means there's a tremendous amount of community spread, and we need to do a lot more testing to get that rate down. Last numbers I was looking at the end of the week, we're averaging about 425 cases per day. And remember, you go back between 6 to 8 weeks ago, we were down to 13 a day. So we're well over 400 now. We're getting that trajectory is going so high, we may certainly surpass where we were at when we were at the peak of this in December and January. And that's why we've been setting off these alarms. 38% of the county residents are fully vaccinated, with 49% getting at least one dose of vaccine. Now, in Jefferson County, we're doing a pretty good job of getting folks vaccinated relative to the rest of the state, but that still pales into comparison of where we need to be for the whole country. So we have a lot of work to do. We got some troubling reports last week. Children of Alabama reported that at a certain point last week, they had 22 patients in Children's Hospital that were being treated for COVID-19, and 5 of those were on ventilators. That's alarming. And because we're having more and more community spread, God forbid, we just fear that this is going to get worse. And our children are very, very vulnerable because if you're younger than 12 years of age, you cannot get vaccinated. And they're depending on the rest of us as a community to decrease the community spread so that they don't have to be in a situation where you have children increasingly going into the hospital, being put on ventilators. Also last week, we know that Governor Ivey issued a renewed state of emergency for the state. And that's due to the increased hospitalizations and that our healthcare workers need assistance, our hospital systems need the burden to be reduced for them, and any bureaucratic red tape needs to be eliminated. So we applaud the governor for making that decision. Here locally in Jefferson County, we have a lot of hospitals here. Over the weekend, we've seen an increase of cases, more than 40 from where it was a few days before. That's just over the weekend. Later on today, the official numbers will come out, so I don't have those numbers yet, but look, about midday, we'll have those definitive numbers for everybody. Also, everyone is asking about these additional doses, these booster doses of vaccine. I want to talk about that real quick. So starting today, throughout our community, certain people that are immunocompromised can get a booster vaccine dose. That's either the Pfizer or the Moderna vaccine, not the J&J. But this is for people that are considered immunocompromised. What does that mean? Well, the CDC has given out a list, and I'm going to read those to you right now. So if you're getting active cancer treatment, you're high risk. If you received an organ transplant, so think about this. If you had a lung, pancreas, kidney, heart transplant, you're high risk. Stem cell transplants, if you have an immunodeficiency, some people are born with immunodeficiencies, and some people get acquired immunodeficiencies. You're very at increased risk. And then another thing that people don't think about is if you're taking high-dose steroids for a long time to treat medical conditions, that also puts you at risk. All those conditions weaken your immune system. So that means, and this is all driven by data, they looked at people that had been vaccinated with any of these vaccines, and they were looking at whether or not they were able to acquire COVID-19 and get really sick from it. And that we talked about that 90% effectiveness for the vaccines, but when you put it in someone who has a compromised immune system, it's not 90%, it's less. So that's why the CDC has taken a step to say we're going to recommend additional quote-unquote booster doses for those select individuals. This is not for people that have diabetes or heart disease, because that's another common question. But what you need to do is call your personal healthcare provider and ask them about your personal risk, and they can advise you. Now, if you do get recommended for the dose, the recommendation that we say, and based on what the CDC is saying, is at least 28 days after your second dose. So even if you got the second dose 4 months ago, you can still come and get that dose. Now, at least at the Jefferson County Department of Health, at all 3 of our centers, our Western Health Center, our Eastern Health Center, and our main headquarters that is downtown Birmingham, we've been vaccinating all week long, any vaccine product you can get. So we're offering the vaccine all day long, 8:30 a.m. to 4 p.m. at the health department, and a lot of our community partners are doing the same thing. So I'm going to leave you with some really key recommendations for our community. If you are not vaccinated, get the vaccine. We strongly encourage everyone and urge you to get the vaccine now. We have run out of time. We know that what's happening down in Mobile is devastating. We have reports from Mobile where they don't have enough room in their hospitals. They have people lining up in the gurneys in the hallways. We have the paramedics that are then doing observation, but then they have to get the ambulance to go pick up the next person. But if you don't have room in the hospital, then the ambulance has to go somewhere else further out. So think about this. What if you are suffering from stroke symptoms, a heart attack? Normally you would go to the emergency room. That's what you should do. But what if that hospital is filled up with COVID patients? Then they don't have room to get you in. So we can't just only think about COVID when you look at the ramifications of how this spread is happening. This is impacting our whole system. Number 2 recommendation, wearing the mask. All right, so if you are indoors, everybody should be wearing a mask irrespective of your vaccination status. Now, this changed. Now, several weeks ago, we were saying that unvaccinated people should be wearing a mask indoors. Now it's vaccinated and unvaccinated. Why the change? Well, there was a study that was done, and with the CDC looked at the data, and they found that people that were fully vaccinated could transmit, that means pass the COVID-19 infection on to someone else just as good as someone who was unvaccinated. That doesn't mean a vaccine doesn't work. It just means that a vaccinated person can also be part of passing it from person to person. So some people then ask, why should I get vaccinated? Well, it's easy. When you look at people that are in the hospital and the people that are dying from COVID-19, 90-something% of those people are unvaccinated. Now, vaccinated people can still get COVID, but they're likely going to have very mild symptoms, if any, and you have a good fighting chance. So just think about this. If you're in a war situation, you can choose to go into the war situation with armor on and a tank as you're getting attacked with all these missiles from a COVID virus. Or you can go with no armor at all and take your chances. When you get vaccinated, you're putting the armor on. No, you're not bulletproof, but it's a lot better than going with no armor at all, and that's what we're trying to get across to people. So the last thing I want to talk about, and we're talking about recommendations, we are strongly recommending, if you are a business owner, if you're operating any facility where people are coming in for indoor spaces, including schools, everyone should have a mask on. Right now, we want everyone to use their own devices to make decisions on what they're going to do with their health care about vaccination and masking. But we're at a critical point where there's not enough people that have been vaccinated. If everybody that's unvaccinated came today to get a vaccine, it's going to take weeks for that immune system protection to build up. So we need everyone to get vaccinated, but there's going to be a delayed effect. It's going to take time. So what else can we do? What are we left to do? Well, masking and social distancing is what we know we did last time. That's why we're telling people to do it. Now, we have to do this. When you're indoors, everyone needs to mask up. So with that, I will hold questions to the end, and I'll have my colleagues from the nursing profession come because, as you know, nurses have always been on the front line, and I think it's really important for everyone to hear directly from our nursing colleagues. Thank you.
Good morning. My name is Lindsay Harris. I am the president of the Alabama State Nurses Association. And I'd like to thank President Parker for this opportunity, as well as that great update from Dr. Hicks. We stand here together in unity. We are unified with our Nurses Association across the state, the Jefferson County Department of Health, as well as our city councilors, urging everyone to stay safe. As Dr. Hicks just mentioned, nurses and healthcare in general, we are at a strain. Healthcare is at a strain right now, and we are urging everyone to listen to your health officials and wear your mask, social distance, and maintain proper hand washing. And last but not least, please get vaccinated. Please do this for your family, for your friends, mother, grandmother, and children. COVID-19 knows no age, race, gender. So please get vaccinated.
Good morning. My name is Deborah Thetford Zimmerman. That's D-E-B-O-R-A-H, Thetford, T-H-E-D-F-O-R-D, Zimmerman, Z-I-M-M-E-R-M-A-N. I am a registered nurse and the immediate past president of the Birmingham Black Nurses Association. Let me thank Council President William Parker for giving us this platform to give the true facts on COVID-19 and to encourage everyone to get their COVID-19 vaccine. The Birmingham Black Nurses Association President Aileen Nash and our President-elect Pat Curry could not be here with us today. So they sent me. You know why? Because they are at work. They are nurses at work taking care of people who didn't get vaccinated. They are working long hours, some without even lunch breaks. They're working different shifts, depriving themselves of sleep and worrying about taking COVID-19 vaccine home to their families. So please, get the COVID-19 vaccine. If not for you, for your family, your friends, and your coworkers. So be safe and stay safe, Alabama. Thank you.